Today I'm here with Jason Ahola, Associate Professor of Beef Production Systems at Colorado State University. Jason was one of the lead researchers on the National Beef Quality Audit, and today in Denver at the National Cattlemen's Beef Association, the 2011 Beef Quality Audit was launched. Jason's going to share with us the components of the audit that he worked on. Jason, you presented the results of Phase 3 of the National Beef Quality Audit, the 2011 audit. Can you tell us what Phase 3 consists of and some of the overarching components that came out of Phase 3 and what Phase 3 is?
Okay. Yeah, Phase 3 was the first time there has been a Phase 3 to the audits. There's been National Beef Quality Audits since 1991, and they've usually been in a cooler or a harvest floor or a packing plant collecting information. What we tried to do was get producers involved and try to get some of their feedback in terms of beef quality. And so what we did is an online and a written survey across the entire United States of every segment of the industry, from seed stock, commercial cow-calf, dairy, stocker, any beef industry segment, to try to get input from those producers relative to a few key things. The first one was, what are their views about quality? What does quality mean to them? We also asked them, how do you think you influence quality? And then we also asked them what types of procedures they're doing on their operations relative to beef production. Injection sites, how they're handling cattle, record keeping, a variety of things like that. And then ultimately we asked them, do you participate in beef quality assurance? And at what level are you certified? Do you know about beef quality assurance? Those kind of things. And ultimately what we're trying to do is develop a data set to which to use a benchmark for future audits and to try to understand how all segments of the industry influence quality.
Great. You mentioned that one of the questions that you asked the producers was, what do producers think about when they think of the word quality? What was some of the results or key points that you got from that, asking that question?
Yeah, when we asked them, when you hear the word quality, what does that mean to you? The top two responses were producing cattle and calves that are healthy, and then the other aspect was producing beef that is safe and wholesome. Far and away the top responses. They also responded to things like USDA quality grade and eating satisfaction, but the top two things when they heard the word quality that meant to them was the health of cattle and also basically the safety and wholesomeness of beef that's produced from them.
And what practices are producers doing to influence quality?
Yeah, we also asked them, how do you think you influence quality? And 96% of the producers said they thought at some level on their ranch or farm, they were influencing quality. The two main areas that they felt they were influencing quality, number one was through the use of stockmanship, or use of good stockmanship and animal handling skills. And then the second one was through preventative health care, for instance, the use of vaccines, vaccinations, and that sort of thing. So it's pretty clear that low-stress cattle handling is one way they think they absolutely influence quality, and then the other one is providing a healthy calf or yearling or whatever down the supply chain toward the feed yard.
Great. Many of the questions that you asked the producers were, you didn't specifically ask them if they were BQA certified, but you asked them about quality assurance practices. What implications did you see from asking those questions that producers are following many BQA practices?
Yeah, there's lots of beef quality assurance guidelines, and we didn't get into all of those, but we did hit some key ones. Some of the major areas were injections and how they give those, and 87% of producers choose the neck as the the preferred region of giving an injection over the rump or some other areas of high value cuts. 84% of producers chose subcutaneous or under the skin rather than intramuscular. Both of those are big changes over time, but this is the only time we've actually asked producers this question. We also asked, what is the tool that you use, the primary tool you use to move cattle when you're working them, what we call a driving tool. And a sorting stick was the number one use. We also asked them, do you use an electric prod? And less than 2% of producers said they use that as their primary driving tool. We also asked a variety of questions about record keeping. One of the interesting results was over 3/4 of producers use individual animal identification to track withdrawal times for drugs or pharmaceutical products have withdrawals, indicating that's a very large number of producers, and it suggests that there's an opportunity for record keeping and tracking cattle through the use of an individual animal ID for other purposes.
So what impact do you think BQA has overall, or the BQA practices that producers have been following have on a benchmark study like this, such as an audit?
Yeah, the one piece of information we have over the last 20 years are things like bruising, injection site lesions, carcass quality, a lot of those things. And Dr. Savel presented some data about incidences of bruises were down. They didn't directly look at injection sites, but generally quality of beef and the incidence of defects has been no better than today. I mean, it's a tremendous increase since the first audit started back in 1991. We can't say that those are all due to beef quality assurance, but I think we can clearly say beef quality assurance has had a major influence on the quality of beef, and we've seen that in today's results that were presented. Beef quality assurance has been around since the 1980s. The audit started in 1991, and I think we could really say a lot of the results that we've seen are directly attributable to a beef quality assurance program that's widespread. It's 45 states across the country. It's nationally led and has a set of guidelines that a lot of producers are following. So I think we can really say that there's a lot of accomplishments that can be directly related to the success of beef quality assurance education.
All right, so any closing take-home message for producers, since the Phase 3 portion of the audit that you worked on was with producers?
Yeah, I will say, and this gets a little bit into the one of the other phases that Dr. Keith Belk led, but the results in that phase said the number one concern of people in the beef supply chain is how and where cattle were raised. And a lot of the results today suggested that the beef industry needs to do a better job of telling the beef story. And I think that's exactly what Dr. Belk found, is that we need to provide more information up and down the supply chain. So I think we could say producers, the vast majority of them, are doing things right and in a very solid manner to maximize quality. A few of them are doing things wrong. And without telling the story or documenting anything or having information flow, the average consumer can't tell the difference between the two. So if somebody does something wrong and they make it into the media, unfortunately, that consumer that sees the media puts the entire beef industry in one big pot, and they say the entire industry is doing things wrong. Based on Dr. Belk's data, more information is needed. It's time for commercial cow-calf and seed stock and stockers and feedlot, all of these segments, to step up and start telling their story and what they're doing right, so that when something comes up that's wrong, they can be on the higher ground and take advantage of that and really protect themselves from the risk that the whole beef industry is under with increasing concerns by consumers.
All right, well, thank you, Jason, for your comments on the Phase 3, the producer focused portion of the National Beef Quality Audit that was released here in Denver at the Summer National Cattlemen's Beef Association meeting. And thank you for your contribution as a researcher towards gathering this information for this benchmark study.
Thank you.